Have you ever wondered how one breakthrough study could reshape the future of medicine overnight? Welcome to Shock Doc Medical, where every episode is a journey into the cutting edge of healthcare innovation. I'm Dr. Rod, and today we're diving into a topic that's absolutely essential for anyone curious about how the healthcare business really ticks. Today, we're exploring the intricate landscape of the healthcare industry as laid out in Lecture 2. Understanding the healthcare business landscape. Now, I know that might sound like a mouthful, but stick with me. This episode is packed with insights that touch every part of our lives, from the way we receive care to how organizations operate behind the scenes. Imagine sitting down with an old friend over a warm cup of coffee and discussing not only your health, but the very system that cares for you. That's exactly what we're doing today. We're going to break down the healthcare business, exploring everything from its complex network of stakeholders to the economic forces that shape patient care. Here's a little teaser. We'll discuss how integrated systems, like large hospital networks and accountable care organizations, differ from more fragmented networks seen in independent practices. We'll also highlight how technological advancements, think electronic health records, artificial intelligence, and telehealth, are revolutionizing the way care is delivered. And yes, while we're in the spirit of full disclosure, if any treatment was mentioned, we'd dive into specifics like medications and doses. Although today's episode focuses on business structure rather than direct treatments, understanding the system is key to appreciating how clinical innovations eventually reach you. Specifics like medications and doses. Although today's episode focuses on business, let's start with the industry overview. The healthcare field is a sprawling, interconnected network. It's not just doctors and patients. There's a whole ecosystem involved. We have healthcare providers, insurance companies, suppliers, regulators, and even technology partners. Each one plays a crucial role in shaping how care is delivered and how organizations run their operations. Now, consider this. In some regions, care is delivered through highly integrated systems like large hospital networks. These systems emphasize care coordination and seamless patient experiences. In contrast, many areas still rely on fragmented networks with smaller, independent practices. This difference doesn't just affect patient care. It influences billing, regulation, and even the day-to-day management of these facilities. When you're at your local private clinic, typically run by individual practitioners or small groups, you're experiencing a more personalized approach. But these clinics often face challenges like limited resources and stiff competition. Meanwhile, hospitals with their multiple departments and advanced technology are highly sensitive to economic shifts and regulatory changes. And let's not forget telemedicine and virtual care providers. Thanks to technology, remote consultations are now a major part of our healthcare system, bringing both convenience and unique challenges. So, what trends are shaking up the healthcare business? First up, technological advancements. Innovations like electronic health records, EHRs, AI in diagnostics, and telehealth have the potential to transform patient outcomes while streamlining operations and reducing costs. It's a thrilling time when the future of healthcare meets cutting-edge tech. Next, we have demographic shifts. With an aging population and a rise in chronic diseases, there's an increasing demand for specialized, continuous care. Healthcare providers must adapt to these changes to meet new challenges head-on. There's also a shift toward consumer-driven healthcare. Patients today expect high-quality service, accessibility, and transparency. This expectation pushes providers to innovate constantly and improve the overall patient experience. And then, of course, economic pressures, like the move from fee-for-service to value-based care, are forcing healthcare organizations to balance quality with cost-effectiveness. Providers are now more focused than ever on benchmarking performance, analyzing competitor strategies, and ensuring operational efficiencies to stay ahead in a competitive market. Let's talk regulation, the framework that ensures patient safety and operational stability. The healthcare sector is governed by a myriad of laws and standards. Agencies and organizations like HIPAA in the US ensure patient data protection, while bodies such as the Joint Commission set high standards for clinical safety and quality. These regulatory bodies aren't just bureaucratic checkboxes. They are vital for building patient trust. Compliance means your personal information is secure and that the care you receive meets stringent safety protocols. Non-compliance, on the other hand, can lead to hefty fines, legal issues, and a loss of public trust. It's a continuous process of audits and improvements that ultimately benefits both patients and healthcare providers. Now, let's take a moment to imagine this in the real world. Picture a patient navigating through a highly integrated hospital network where every department works in sync thanks to advanced EHR systems. Now, contrast that with someone in a fragmented care system where communication gaps can sometimes delay critical treatments. How does this impact outcomes? What if these systems could share best practices more seamlessly? I've had the privilege of hearing from industry experts who stress that understanding these business dynamics is as crucial as any clinical breakthrough. They remind us that every technological innovation, every regulatory update, every economic policy decision directly affects patient care, whether it's through improved access, faster diagnosis, or more efficient treatment plans. As we wrap up today's deep dive into the healthcare business landscape, remember that knowledge is power. Understanding how these systems work not only informs us about the challenges, but also the incredible opportunities for innovation in medicine. If you found today's episode enlightening, please like, subscribe, and share your thoughts or questions in the comments. Let's build a community of curious minds passionate about the future of healthcare. Next week on Shock Doc Medical, we'll uncover another groundbreaking discovery that might just change everything you thought you knew about patient care. Until then, stay curious, stay informed, and as always, keep pushing the boundaries of medical innovation.